Good morning. I'm S.Akshana, nursing tutor from ES College of Nursing. So today I'm here to present the topic liver cirrhosis. So the definition of liver cirrhosis. The cirrhosis is characterized by fibrosis and nodule formation of the liver secondary to the chronic injury, leading to alteration of a normal lobular organization of the liver. So it is a chronic liver disease characterized by the scarring of the liver that involves the formation of fibrous, that is scar tissue, associated with the destruction of the normal parenchymal cells of the organ. It is a result of long-standing injury, most commonly due to the alcohol in excess, but there are a number of other important causes. So the destruction of the normal cell structure and the loss of liver cells prevents the liver from functioning normally. So the etiology of the liver disease, that is, the first one is a alcohol liver disease, chronic active cirrhosis, primary biliary cirrhosis, and hematochromatosis, Wilson disease, cystic fibrosis, alpha-1 antitrypsin deficiency, galactosemia, glycogen storage disease, and Indian childhood cirrhosis. So moving on to the pathophysiology, due to the etiological factors such as hepatitis or a fatty liver that leads to the development of the scar tissue that replaces the normal parenchymal cells in the liver, this fibrosis blocks the portal circulation of the blood through the organ, therefore disturbing the normal function of the liver, activating the hepatic stellate cells which increase the fibrosis by the production of myofibroblast. Formation of the macro and micronodules separated by the fibrous tissue band that makes septa, that leads to the decreased blood flow, and that leads to the portal hypertension, and that leads to the ascites. So finally the liver cirrhosis will lead to etiological of ascites. So types of cirrhosis, that is alcoholic cirrhosis, that is due to the alcohol intake, and post-necrotic cirrhosis, that is due to the hepatitis, and biliary cirrhosis, that is due to biliary obstruction, cardiac cirrhosis, right side heart failure, non-specific metabolic cirrhosis, that is due to the GI disease. So these are all the symptoms that associated with the other systems, that is the neurological system. It leads to the hepatic encephalopathy and peripheral neuropathy and asterixis, and in integumentary system it provides jaundice, spider angioma, palmar erythema, purpura, petechiae, and caput medusae, and in hematological system that leads to the anemia, thrombocytopenia, leukemia, coagulation disorder, and splenomegaly. In metabolic, it affects the potassium deficiency, hyponatremia, and hypoalbuminemia. In cardiovascular disease, it leads to the fluid retention, peripheral edema, and ascites. In reproductive system, it affects amenorrhea, testicular atrophy, gynecomastia, and impotence. In gastrointestinal system, it produces anorexia, dyspepsia, nausea, vomiting, change in bowel habit, dull abdominal pain, feta hepaticus, esophageal and gastric varices, hematemesis, hemorrhoidal varices, and congestive gastritis. And further moving on to the diagnosis, for the liver cirrhosis, we will do the confirmatory diagnosis with the complete blood count, liver function test including alkaline phosphatase, serum glutamine, pyruvic transaminase. Moving on to serum albumin, liver biopsy, liver scan, upper GI barium swallow, CT abdomen, MRI abdomen, and ultrasound abdomen. So treatment for the liver disease, all patients with the cirrhosis can benefit from the certain lifestyle changes includes stop drinking alcohol, limiting salt intake and diet, get vaccination for the influenza, hepatitis A and B, and pneumococcal pneumonia recommended by the doctor. And generally, liver damages from the cirrhosis cannot be reversed, but treatment could be stopped or delayed further progression or reduced in complication. The healthy diet is encouraged, and the cirrhosis may be an energy consuming process. So antibiotic will be prescribed for the infection, and various medication can help with itching. Laxatives such as lactulose decreases the risk of constipation. Alcoholic cirrhosis caused by the alcohol abuse is treated by the subsiding from alcohol. Treatment from hepatic cirrhosis involves medication used for treat the different types of hepatitis, such as interferon for viral hepatitis and corticosteroids for autoimmune hepatitis. And finally, the liver transplantation is a solution. So moving on to the complication. The complication of the liver cirrhosis are liver failure, splenomegaly, ascites and bacterial peritonitis, portal hypertension, kidney failure, hepatocellular carcinoma, mental confusion, change in level of consciousness, and coma. So the nursing diagnosis for the liver cirrhosis is acute pain related to liver enlargement secondary to ascites as evidenced by the facial grimace. Second one is activity intolerance related to fatigue and discomfort, imbalanced nutrition less than body requirement related to chronic gastritis, decreased GI motility and anorexia, altered breathing pattern related to decreased lung expansion secondary to intra-abdominal fluid collection, that is also called as ascites. So next one is a risk for injury and bleeding related to altered clotting mechanism, and fluid volume excess related to ascites and edema formation, and finally altered coping skills related to the disease. So the nursing intervention is the most important part in the nursing. So that is, the first point is provide comfort measures such as the back rubbing and changing position to relieve the pain, teach the patient the relaxation technique like deep breathing exercises, provide quiet and calm environment, give analgesic to relieve from pain and fever, evaluate the patient current activity tolerance and adjust activity and reduce intensity of the task that may cause undesired physiological changes, help and encourage the patient to eat, feed the patient when fatigued and let someone near to help the patients. So keep the head of the bed elevated to facilitate breathing by reducing the pressure on the diaphragm. Restrict the intake of caffeine for the patient with the liver cirrhosis, like gas producing or a spicy and excessively hot or cold food, to aid in reducing the gastric irritation and abdominal discomfort that may impair the oral intake or digestion. So protect the patient from bleeding, monitor the urine, stools, gums, skin for signs of bleeding and bruising, teach the patient to use a soft toothbrush, avoid constipation, and administer the vitamin K as orders. So these are all the references for the liver cirrhosis which we have seen in the slide.